Thank you so much, Dr. Lam. I've really been looking forward to this conversation. And I guess what I'd like to start off with is, can you give us a little bit of background on why Ultrasound AI was founded and how it is revolutionizing the prevention of preterm labor?
Absolutely, Kelly. So it's my pleasure. Thank you for this opportunity. The origins of Ultrasound AI is actually kind of a rather folksy story. And I hope you get the chance to meet with the founder and originator of the AI itself. That's Bob Bunn. But Bob, basically, the story goes, he is an AI data scientist, and he was working in industry outside of medicine. And what he realized is he wanted to use his skills in artificial intelligence programming to do something for the greater good in medicine. And so he had some past experience with multiple miscarriages and losses in his own personal life. And he decided, well, why can't we develop an AI to kind of help work on the problem of preterm birth and pregnancy loss? And long story short, he basically built and developed and trained an AI based on his obtainment of ultrasound images through a third-party agreement. And he showed that the AI was able to make potentially predictions on which women would deliver early and potentially, how soon they would deliver.
So the technology that you're offering through Ultrasound AI is not just beneficial, obviously, to the expectant mother, but I would imagine a very welcome tool by obstetricians.
Oh, resoundingly so. Yeah. So we can alert the caregiver and the patient herself to her risk of delivering early, and not only potentially that she's at risk for delivering early, but potentially when she will deliver in relation to that timing of an ultrasound that's done.
So it's not limited in its value towards the front end or the middle of a pregnancy. It has application throughout the term.
Yeah, absolutely. So that's the beauty of what Ultrasound AI offers. So we are using a readily available modality, which is ultrasound, which should be present at almost any level of care. Mm-hmm. And what we do is our program can make predictions for a woman's risk for delivering early and timing for when she'll deliver based on the images captured during her exam. Now, it's highly dependent on the number of images that are done and also the timing in her gestation. Mm-hmm. But yes, any time that an ultrasound is done, when a woman comes into the hospital or to the office or to the clinic, we can make a prediction, or in the heat of the moment say, hey, yeah, our prediction is that she's going to deliver, say, within the next 5 days. Right. We got to get her to the right institution. Right. So yes, so the great benefit and why I'm signed on with the company and working so hard to make this a reality is because we have something that's not a blood-based test. It's instantaneous. You get your ultrasound done, you send the images over to the AI. The AI makes predictions, spits it back to you right away. And now you have a reliable prediction about what will happen potentially to this woman, to this patient, and you can act accordingly.
Oh, that is fantastic. Now, let me ask you this, because artificial intelligence or AI has received a lot of attention in the last few years.
Yes.
And there's been a fair amount of misinformation that has come out as well. And so what is it important for people to understand about artificial intelligence, especially when it comes to healthcare?
Yeah. So there is, I don't want to say a misrepresentation because it's not truly a misrepresentation, but perhaps a misunderstanding about how artificial intelligence has grown and developed. Mm-hmm. So early on, artificial intelligence was very simplistic in medicine. Mm-hmm. And what we did was basically program computers to kind of help basically look over a doctor's shoulder and say, hey, this process that you're doing, am I missing any steps? It puts up these little warning signs or notifications saying, hey, this drug maybe not shouldn't be given because it might interact with this other drug the patient's on that you might not remember or might not know about. Right. So it was meant to be kind of almost like a fact checker error sort of thing. Recently, over the last few years, I think, in the field of AI, we're seeing the capabilities of AI grow exponentially. And the reason why is because computers, well, we as humans, number one, the smart guys who know how to do artificial intelligence are better at structuring artificial intelligence to actually learn and grow. So it's basically teaching like a young child how to, do something. And then as that child practices and matures, it gets better and better and better at its skill. That's what AI is now. And AI now has the ability not only to just be a fact checker or to say, hey, I know these protocols and you're not following them, but it's got the potential now to be almost a true partner with the physician.
Just think of the volume of data that is incorporated. And to your point, it only is going to get better the more usage that it's applied toward.
Absolutely. Kelly, you just hit on a perfect characterization representation of what the power of artificial intelligence can offer. Each individual only has one brain, and we can only process so much information at one time.
Yeah.
But the power of supercomputing and AI basically is able to link the power of literally thousands to tens of thousands of brains because the computer can process things and take into huge exponential amounts of data, much more than a single human brain can do.
So we certainly know as professional communicators that effective communication is essential to trust. And so as a physician, what do you see as important for an obstetrician to communicate to their patient regarding the benefits that ultrasound AI is providing?
Great question. So the basis of any good trusting relationship is to be accurate, to be factual, to give good information. Because if you give wrong information, your credibility is lost, even if you don't intend to give wrong information.
Sure.
Now we have something that can give you a much more quantifiable and data-driven prediction. And so you can feel more confident, tell your patient, hey, this is the best data I have. It's much more reliable. We should feel more confident that this is how we should proceed and do things.
Well, and a patient's confidence in their providers is so essential, really, in every healthcare situation. But it's really exciting to have this additional tool soon in the hands of obstetricians. And I can only imagine great success. So I appreciate so much your time and look forward to seeing all the great things that ultrasound AI is able to accomplish.
Thank you, Kelly. Yes, I hope so too. We'll keep working.